we can learn a lot. Really, we'll learn a lot about how the brain works.
It's a mixture of neuroscience and preventive science, basically.
As a scientist, I often get frustrated that maybe health policy, drugs policy is not entirely based on scientific findings.
Was mir oft auffällt, ist, dass in der Medienberichterstattung wird das Phänomen der Drogenmärkte im Darknet oft sehr übertrieben dargestellt. Es werden irgendwelche Fantasiezahlen verwendet, Zahlen, die nicht auf wissenschaftlichen Erkenntnissen basieren.
So we were discussing the potential benefits of bringing together the different disciplines. That was like the initial spark that brought drug science into the world.
We invite you, the participants of this conference, not only scholars, to engage in such a dialogue, to value the complexities of this knowledge, and not to make use of political arguments too soon.
And some of the speakers were well respected in the field and did very good demonstrations.
There was a very high degree of interdisciplinarity. It was clear that there was fresh, ongoing research, and practically every talk I've listened to was really substantial and of a high academic quality.
We wanted to take the opportunity, to use the opportunity to bring psychedelic medicine together with all the other drug sciences.
Towards addiction or social science.
Yes,
so there's many preconceptions prevailing in certain areas of research, and we would like to overcome these preconceptions.
I'm doing my master's in neurosciences.
Als Politikstudent interessiert mich natürlich der Politikteil sehr.
Ich bin ja mehr ein klinischer Forscher, der sich also um die Evaluation und den Outcome, um Behandlung kümmert.
Ich arbeite gerade in der Psychiatrie auf der Suchtstation und ich finde es auch abgesehen von meiner Arbeit spannend, was sich da gerade alles so tut.
Die neue Grundlagenforschung für die psychiatrischen Erkrankungen.
Well, I've been pushing for it since 1969.
Viele Wissenschaftler, größtenteils Wissenschaftler, 2, 3 junge Leute mit Dreads, aber insgesamt auch Wissenschaftler kommen hier an, bekommen ihre Badges und wenn ich kann, gebe ich noch weitere Informationen. Wie jetzt, guten Tag.
Eigentlich soll ich jetzt in meinem Flieger sitzen.
Oh.
Und die haben den einfach gecancelt.
Okay.
Air Berlin.
Aber dann haben Sie
Aber dann
noch was zu
kann ich
sehen.
den letzten Tag noch
Das ist doch super. Wollen Sie das Gepäck abgeben?
Eben.
Ja, dann bitte einmal.
It's been a very impressive environment, and I've really liked the fact that we're in a traditional anatomy lecture theatre.
The conference took place at Charité Campus Mitte.
I very much like the existential atmosphere that surrounding in the Institute of Anatomy added to the conference.
I actually like the fact that I'm giving a talk and potentially, great things have happened in that lecture theatre before.
We were first hoping like maybe 100, 150 people would come, and then it was like, oh wow, 300 people come, fantastic. And then it was like, oh, how do we take care of all these people? When we first analyzed the bias of the conference tickets, we realized that many were early career researchers, like in their 20s and 30s. And we thought, well, people coming to Berlin, they expect some of its vibrance and cultural and artistic aspects Berlin is renowned for. So we thought of, why not organizing a party? For some reason, immediately, 2 artists approached us independently and asked whether they could contribute to a party that matches the theme of drug science.
Yeah, interdisciplinary works between neuroscientists and artists. It should happen more. Let's do it. If you have some interesting research and you want to do something weird with it, send it my way. I would love to mangle it into something strange and beautiful that will be appreciated by people in this room as well as those not here.
Thinking very strictly and thinking very logically also lets you forget about the complete picture sometimes. And the arts are bringing that into the whole event.
Thinking back, it is almost overwhelming how diverse and manifold the people attending and the topics, where usually you'll see people interested in psychopharmacology and they'll talk to psychopharmacologists. You might see addiction experts talking about addiction. You might see people from the social sciences criticizing certain aspects of how society handles the current situation. But you never see them sitting together on a table or in a lecture room and having a dialogue about the topics that are important to them.
And that is what is great about a conference. You meet people, you talk about real stuff that you want to do and improve the lives of real people.
So it's not only about ideas, it's about realizing ideas.
I have never seen a conference like that. In case of interdisciplinarity, we really went beyond what's usual.